Order. Josephine, can we have roll call, please?
Josephine.
Josephine?
Okay, starting.
Okay.
Toki Bala, Captain. Beverly Gotelli,
Here.
Louis Johnson,
Here.
William Hinaka,
Excuse.
Stephen Long,
Here.
Sarah Medeiros.
They'll be late.
Oh. Shirley Ogata,
She'll be late also.
Lucy Sober, Marilyn Seeley.
Here.
Thank you. Barbara Service. Let's see. Gary Simon,
Here.
Lisa Spencer.
Excuse.
Excuse. Rick Tabor.
Here.
Leslie Tanoy.
Here.
Thank you. Raylene Tano.
Here.
Okay, let's see. 1, 2, 3, 4, 5, 6, 7, 8. Wow. We just made it 8. 1, 2, 3, 4, 5, 6, 7, 8. 8 members. Quorum.
Okay, thank you, Josephine. We do have quorum. Okay,
Yeah.
we need to, thank you. We need a motion to accept the minutes of May 1st.
I'll motion, Rick Tabor.
Thank you. Rick moved. We need somebody to second the motion. Okay, Stephen seconds the motion to, for the adoption of the May 1st meeting. Is there any discussion or corrections? Seeing none, hearing none. We will accept the minutes with no objections. Thank you. Going on, EOA Director's Report.
Okay, well, hello, everyone, those on Zoom. June is Elder Justice Awareness Month, and if you're interested, I can send out a link to various webinars that are available through the Administration for Community Living. EOA's legislative session, it was a good one. We had 428 aging and disability related bills and resolutions that we submitted, about 67 testimonies. So we're following over 400 bills submitted, 67 testimonies. We did take a slight hit in our state budget. We had a reduction of about $382,000. So we don't want to have too much of an impact on our programs and services. But we also need to keep the office running. So we're trying to look at where we can take this reduction from. But the good news, and I announced this, I think, at the legislative committee too, is that they were looking at a lot of vacancies. Ways and Means was looking at vacancies and where they could have cost savings. So, I mean, everyone's vacancies were being looked at. So anything that was more than 5 years old that was on an org chart, but did not have that was on an org chart, but did not have the position filled, they were recommending to have cuts. So we were able to rebut some of those. We didn't have anything that was more than 5 years, but they did mark our vacancies. So, I mean, there was one that was only not even a year old and they marked it as a potential for reduction. So I did not have any reductions in staff, which is a good thing. However, we did take that reduction in funding. So we are, part of my next budget request is to ask for these funds back. So, I had the honor of attending all 3 Neighbor Islands Older Americans Month celebrations. They were all so nice. I had such a great time, and I just want to thank the counties for that. And oh, I need to bring it in. It's outside, but we do have a website called Kapuna Ready that was stood up by our advocacy education outreach section, and it really prepares individuals for disaster preparedness. So it's a flyer. You guys are more than welcome to take. I'll have it brought in. I'll put it on the table, and you guys can go ahead and take a look at it. It really did gain a lot of publicity during the Kona lows because we use that as, it had been stood up a few months before, but, you know, people were asking, where can people go for information? We're like, hey, we have a resource for you. So that's how that came to be. So we're really happy with that. Let's see. Oh, yes. Thank you. I have such a good chair. July 10th, we will be doing an orientation instead of our committee meetings that day. So from 9:30 to 11:30, we will be conducting orientation. And we really would like, if everyone can come in person, that would be best. If you really have extenuating circumstances, you have to come in by Zoom, but we would really like to have everyone in attendance. EOA will be providing lunch and no committee meetings. And lastly, I'm gonna miss Shelley. I think we've worked together. Oh, been a long time, Shelley. Shelley's turning out, but yeah, we just want to thank her for her service and also for Bill Kanaka, who's not with us today, and also Lisa Spencer, who's also rolling off. Shelley, thank you so much. For the Asian and Disability Resource Center, so sometimes we'll be sitting in meetings and we have all this historical information, we're like, wait a second, and my eyes go straight to Shelley. Non-verbal communication. I'm really gonna miss that, so Shelley, thank you so much for your time on PABEA, we really appreciate it. And this is pretty much it on my report, and I'll hand it back to the chair.
Okay, thank you very much. And going on with all of this, my report. Somehow I missed something.
Oh, no, because I think I touched something.
Maybe you did, but that's okay. I got it here. That's all right.
Oh, okay.
Okay, here it is. I got it. Okay,
Oh.
excuse me. Okay. Like Director said, Shelley, we're gonna miss you. It's been enjoyable knowing you all these years. I think for all of us, the fellowship that we gain from each other is so invaluable. Hope to see you on the Big Island.
Yes,
Okay.
please,
Okay.
come visit.
Okay, we will. Okay, monthly updates. Like Director said, she was fortunate to come to Kauai for the Older American Month celebration. And so it was really nice seeing her there. I also attended our Older American Month celebration on Kauai, which was very nicely held. And although we're the last ones to hold ours, our turnout was really good. And like we said to some of the recipients there, it looked like they were going to graduation all over. Amount of things that they received. Yeah. Okay, the director and I did do some serious business too, though. We did work on the agendas that we have of how to streamline some things that we think could be done a little bit more efficiently and making better use of our time. Okay, as we go forward.
We also outlined our
Oh,
orientation.
okay,
agenda.
that's true. Okay, we did. We outlined the orientation agenda just to make sure that we didn't miss something, or something that if a new person coming into PABEA, and I had to go back and look at my own papers, and it was in 2019 or 2020, okay, that I received my first notification. But what does all this notification mean and everything else? So how do we help a new member coming onto PABEA understand their roles and responsibilities? Our committee chairs, what are their roles and responsibilities through the committees? Okay, but it's interesting as the process goes on, and I thank Director for all of her help. And I also definitely thank all of you here, because without all of you here, we do not have a policy advisory board for elder affairs. Okay, it's the committee members who help make it what it is. Okay, so going on, legislative committee, Rick.
Okay. So we met this morning and went over all the bills that passed, the ones that didn't pass, and it was pretty productive meeting as far as covering everything that was out there. And then we talked about, because of the orientation, of course, we're not gonna meet again until August, and then in August, we'll reshape kind of how we're going forward for the next year. Yes. So if you want to, I won't go over all the bills here, it's taking too much time. So if you want to see those, you can certainly take a look at, have we sent it out to everybody?
I think Christina did send that.
So there's if you've gotten this, if you haven't, let us, That's a good-
Provide you a copy.
good breakdown. Okay, that's it for that.
Thank you. Plans and projects review committee, Raylene.
I forgot I had to talk, so. So we had our meeting today,
it was very short, and we kind of discussed the ongoing, template that we hope to continue to use for future committees. Essentially, I think that was it. Hmm?
The year-end review,
The year-end review,
that Lisa did.
huh?
Yeah, that Lisa did, remember, we were looking at all of that, and Lisa did our nice reviews for it.
Oh, yeah, that's what I was alluding to, that, the write-up that Lisa had done on our project to, past year, we created a template for all the area agencies to use, which has made it really easier to read and, get the real good, just, it was easier to read because we're kind of like more bullets and it's more specific to the goals, to identify them. It's easier for us to evaluate that. So, that template will be part of ongoing, procedures, even moving forward, even though the committee might change.
Thank you. Rack, we
Okay.
are great event.
All right, it's almost showtime, so next Friday is it, the 12th. Doors are gonna open at 8:30 to set up. We don't have as much to set up as we did in past years, but you're welcome to come anytime, 8:30 and on. We'll start at 10:30. We'll hope to wrap up before 1:30. Last year we finished a little early. Everything's in.
Progress.
Caroline's got the bowls, the pictures are framed, the proclamation's framed, so, and Barbara picked up the lays already, so we're all good to go. Okay, I think we have, what do we have, 64 people, 63 or 64 people
63,
coming?
64, something like that. We're not too sure yet, so
Yeah.
we'll be excited if he does show.
Yeah,
Yeah.
yeah. Yeah, I'll leave it at that. It's pretty exciting. We're almost there.
Yeah.
Rick, do we know what our assignments are?
Not as many assignments this year.
Mhm.
So Leslie and Kimberly have volunteered to do the registration table. I think Tia will help as far as so getting pictures, consents for photos. There's the lays.
There's the ways, everyone.
We've got the lays. So it's not as assigned as last year because there's not as much to do. It's really just, so we're not giving anything out. So the booklet will be set out and that's pretty much it. Everything will be done at registration table. Yeah.
Okay.
Yeah, easy peasy. One difference this year is I'm gonna play the music. 15 Craigside and us, we set it up so I can go through the speakers on the ceiling, so it'll be more evenly dispersed. And I would ask folks to let me know if it's too loud anywhere, because we can certainly adjust. Most of our kapuna can't hear, so if it's too soft, I can adjust accordingly too. Yeah, so pretty well laid out. For the counties, for folks, what I'd like to do is when you do arrive, you can come up front, we can just walk through the process to make sure we have it even smoother than last year. And then for the awardees, we'll give them up to 2 minutes, no longer, to do an acceptance speech.
That was
I
a
guess-
nice touch last year, by the way.
Yeah, it really went well, so just make sure they know, don't go political. It's an acceptance speech, but volunteerism. If they want to go on the theme, they can certainly do that, champion your health. I said this in the RAC meeting, but I do have an AI version of how to do a speech, an awardee speech. It's pretty cool. So if somebody wants some tips, I think I have shared it with some folks, but we could send it out. And I'll finish with, I went to the Honolulu one, because I don't see Kimberly here or Derek, and it was just beautiful. And, you were there too, yeah?
No, I was on Maui.
Oh, you were on Maui at the same time.
Same time, same day.
So it was the Colina Ballroom that we were in, and we had to go through the gardens because the road is under construction. So it added really added 40 minutes to the drive-in. But I had,
Emmy Kyoto.
Emmy Kyoto and Clem. So I had the Dean of Nursing at School of Nursing, and Emmy flew in from Singapore to spend time with us. And it was just Emmy the whole time, put her in the front seat. She was like, "Oh my God, this is beautiful." I kept thinking she'd want me to stop for a photo or something. But on the way out, we had a serious storm. So 2.5 inches
Wow.
in an hour fell. So it was zero visibility. So going out, she fell asleep. It was so stressful. I looked over to see if she was okay. She just checked out. Yeah, and we were literally hydroplaning. That's lastly,
No.
but the ceremony,
Yes.
the ceremony, Kimberly's ceremony, it was just like all,
Okay.
everybody's beautiful.
Nice.
Okay,
Thank you. Okay,
Great.
unfinished business, there are none. New business. Election of the 2027 officers, and at this time, I'm gonna let director and her staff pass out the ballot.
Oh, okay.
Okay.
Want me to
I'll
take it
give
from you,
Shelley.
Yeah, thank you.
Okay, and online, Josephine will be sending you a ballot directly to those members via chat. And you are to reply to Josephine. Yeah. Thank you.
I don't have a receipt, but I can get one.
okay, just for her, yeah.
Yeah, we can get one.
Okay.
Yeah. Thank you.
There you go.
Thank you.
Once we are done, we give director the ballot.
Just fold them in. Yeah, boy, I sure have a lot of extra.
That's
Thank
okay.
you, Shelley. You can just fold it over and pass it down to me. Let me make sure that Josephine put it. Josephine? Yeah, let me just stick it aside. Should pass this around. No.
What is that?
You.
I have a question. Thank you. To keep a website on your phone desktop.
Okay, while the director and them are figuring out the ballot, there's a question. Is there a way to keep,
Yeah, like this onto your desk,
Okay.
phone
is
desktop.
there a way, can we receive this postcard, Kapuna Ready postcard for those of you who are online? And it has a QR code, and is there a way to keep that QR code on your phone permanently? Anybody have an answer? Always Jason.
There is, how do you do that?
If you open
Okay.
the page, usually there's like a little, it looks like a box with like a little arrow, like the share symbol. Typically, if you click that, one of the options will be something like save to home screen or something like that.
It's kapunaready.org.
Did everybody turn in their ballots to director here? Okay,
Can you
I-
repeat that?
and everybody online, did you folks get to vote?
They just got it.
Okay.
Okay.
It just came out, okay,
We'll
thank
give them a
you,
few minutes.
okay,
We'll take it. Thanks.
so we'll give everybody a few minutes to go on with that, okay. And I would think that in order to get this, it would be under the EOA website. You know, it has one of the links, Connie, is that correct?
Can double check, I'm not sure.
Okay, yeah, because it doesn't have a website for Kapuna Ready.
I believe that's. That's the
QR
website.
code?
It's website. right?
It is a website?
QR
Okay.
code.
Ready by itself.
.org.
Okay,
.org.
thank you. So really, when you get it done, you got to download it
Yeah,
on
I
your,
can't find it, but
okay,
it's
that's
.org.
okay. I mean, you know, computers and websites and everything else, they do their own things, so sorry. Okay? And we just need to wait for director to come back with our results. Okay? But just for some of you to know what this card says, it's connects to free emergency information, natural disaster, power outages, emergency kits, housekeeping tips, food safety, alerts, warnings, emergency planning, mental well-being. And it says it comes from the Hawaii State Department of Health Executive Office on Aging. And
Screen.
this publication was supported by the Administration of Community Living. And that's our disclaimer there. Okay, and it was done because Community of Living, U.S. Department of Health and the Human Services has part of a financial assistance award totaling $115,000. With 100% funding by ACL and HHS. The contents are those of the authors and do not necessarily represent the official views of nor an endorsement by ACL, HHS, or the US government. And on the other side, there is a phone number
Yours is
to
different.
help with free Medicare, and there's a free tips to avoid healthcare frauds and scams. So,
Great.
It's a good card. For those of you online, if you want the card, let us know so that we can make it available to you. Or we might take some to the luncheon next week and we can pass it out at the luncheon.
That's a good idea.
Okay, I mean,
You can throw.
it's a good thing.
You can throw the website into the chat. It's kupunaready.org. Yeah.
Okay,
Caroline said we're gonna give them 3 more minutes for the voting.
okay, Carol, director said we need 3 more minutes because they're counting right now.
Is that an Apple phone?
So we will take a brief recess.
Roughly, they have
minutes.
2 flyers. They have 2.
One.
Gee, you were very explicit on that one. He said 2, you gave him only 2. I would have given it all to him.
Do you want more, Gary?
And you know, I looked at this and I
Think
said,
what
I
it
know
was
why
there.
this is familiar. I gave it out recently
The Democratic Convention.
when we had this event on Hawaii. So that's why the card looks so familiar. Okay. And so everybody, we're on recess till Caroline comes.
Okay. The
Nice
check marks.
card.
Yours is in there.
Nice card, very informative, simple and informative, you know?
Yeah, few more.
Hi, Bev. This is Lonnie Sakamoto. Thank you all for allowing us to share Kupuna Ready and the postcard that we mailed out recently. It was an initiative that began back in 2023, actually prior to the Lahaina wildfires. We just couldn't put anything together. But since then, there have been so many resources and agencies that are putting forth really great information. So it took us about a year to procure a contract with a website developer and gather all the information and format it in a way that's really easy to read and navigate and helpful. And so it's still in its infancy, but it does contain a lot of information. And really, our whole goal was to make it a one-stop shop for anything, whether it's how to keep your pet safe if you have flooding going on in your home, the emergency channels to tune into, regardless of what county you're in. Things that we don't think about, how to replace lost documents and cards, things like that. So we researched heavily, and you'll find that there's links to HAIMA, FEMA, Red Cross, a number of different credible and reliable sources. And the beauty of this site is that aside from making sure that the links work, the information needs to be updated by the provider of the services or whomever made the information available. So it's really easy and sustainable for us. And like I said, as long as we make sure that the links are working, that's really the only maintenance that we have on our part. But we're happy to include any other information that anybody may think is missing and it would be very, very helpful for kupuna or caregivers. We're happy to include it, and our website developer is amazing. And it's just an email and the next day it's on the site. He's very good at coding, and he doesn't use any templates. He hard codes, which basically what that does is it reduces the chances of the site being hacked. So, yeah, happy to share.
Yeah, that's really good. Thank you so much, Lonnie. That's very
You bet.
informative. Okay, it's 12:24 and we will now come back to our main meeting. Okay, Director?
We had 11 of 12 voted for the complete slate, so I think that's official. We have our Bev Gotelli as chair, first vice chair Gary Simon, second vice chair Susie Schulberg. So thank you all for continuing to serve. For Gary coming back, thank you.
Welcome.
Thank you. Yes, thank you so very much. And going on, we look for a very nice next year. There's going to be lots of going on because of the area plans that are coming out.
We're gonna be very
Okay,
busy.
so we are going to be very, very busy, and we don't know what's gonna happen for the next legislative session, so we're gonna keep on looking at what we need to make sure that Kapuna are well taken care of statewide. Okay, going on, public testimony, I see none. Okay, appointed members,
What's that?
are you gonna
That's
talk
your
about
time.
that?
About,
The health thing?
oh,
We're all looking at you. This is like, Arlene, I gotta talk.
okay. So I'm on Honsack, so there's a sub-area funding that came in. Governor secured, so we talked about this in legislative committee, but it was brought up that I should bring it in here with the whole PABEA group. So it's for rural health care, so a holistic approach, health, mental health, everything. Rurally, it's $189 million that governor secured in Fed dollars that's coming in. So each county, so I originally had said I'm on the HONSAC for the whole, all of Hawaii. It's actually split up into sub areas. That's the HONSAC sub area committees. And I went to the first meeting, so they're asking, and I said I would, to bring it to out to the folks that are on different islands to sign up to be on the committees. So they're actively recruiting. They have the committees going, but they're looking for more help. And what we're doing is, as our role in the committee, it's overseeing how the dollars are spent, how it's going, and making, and it's just like here, and making suggestions. So anybody, so we certainly still have room in Honolulu for folks to join, but each of the counties could use some help.
How do we contact?
So same as like with PABEA. So underneath that, the HONSAC is actually listed as one of them. I think what I'll do is, I'll go in and I'll find, it was a little humbug to find. I'll find the website if you don't mind, and I'll have you send out.
To Caroline, and then
Yeah.
Caroline can send it out to all of us.
Yeah.
Thank you.
Yeah, okay.
That's a very good
Yeah.
one. Thank you, Rick.
Chair,
Oh,
did you
please.
adopt the adoption of the?
So sorry. That is so true, Mr. Simon. Thank you for correcting me. Okay, we have to go back to the new business. We had the report from the director on the election results. Is there a motion to adopt
Yeah,
the election
that would help.
results?
All right, I'll motion. Rick
Thank
Baker,
you,
you're looking at
Mr.
me.
Tabor. Seconded by Barbara Service. Okay, it has been moved and seconded to accept the election results. All those, any discussion?
We have a raised hand.
Oh, Marilyn?
This will go to a different category, my statement. It's not related to this.
Okay, we'll come back then. Okay, Marilyn?
Okay.
Okay, thank you.
Then the calendar. Right below that. Item 2.
Oh, no, we didn't take our vote yet.
Oh, yeah.
Sorry.
Moving right along.
Oh,
Okay, okay. All those in favor of adopting, the election results, say aye.
Aye.
Thank you very much, Mr. Simon. I missed that, but done. Okay, the second one is the adoption of the 2026-2027 calendar. The first Fridays are affected by the first Fridays, okay? You received a corrected agenda, calendar. So the July meeting would be July 10th. The January 1st one would be on July 8th. And that is staying in accordance with the bylaws that we meet on the next Friday after a holiday. Okay, so can we have a motion to accept this?
No.
Barbara Service, accept, oh, I'm sorry.
No, I have a question.
Oh,
We
I'll
need
go,
to-
you have
we
to
need
move
to-
it first and then we can do your question.
Go.
So we have a motion to accept. I need a second.
Second.
Okay, Shelley seconds it. Okay, discussion, Barbara.
I just wondered why September 2nd is a Wednesday. Why is that day set? Oh, I tried for that too.
Oh, I had an error? I'm sorry. Sorry, in my haste, I don't know.
It's supposed to be Friday the 4th.
Oh, I'm sorry.
Yeah, but
So sorry.
the amended one that did you amend one?
Yeah,
out?
one went out today. The one
Oh.
went out the other day.
Oh, the one that I printed this morning shows July 9th, which is just,
Oh, I'm
that
so
is not
sorry.
correct.
Okay.
September 2nd, which is not correct. And then what did you say about January? I'm
It's gonna
sorry.
be January 8th. Sorry, there will be a corrected calendar going out.
Thank you.
Thank you. Thank you for bringing that up about the September one. I missed that one, sorry. Okay, Any other questions or discussion?
Can we put the date of the correction? So we make sure we print the right
Oh,
one.
no, we will send it out.
And
in
actually,
another
I
email.
think the
Yeah.
header says
Yeah.
amended at the very top. So yeah, that's not the amended one.
Okay.
Hello, Stephanie?
Yes,
The corrected calendar, was sent out, Thursday, along with I think one of the Hawaii report. So if I ask people to replace this updated calendar with the one sent out last week, so if you go back to the Thursday email, you'll get the updated calendar.
But it doesn't have the September.
Josephine,
It is.
No, it does. I corrected it.
Josephine,
Yes?
can you please send the calendar out to everyone? Just to make sure that we all have the correct calendar.
Thank you. Thank you, Josephine.
Thank you.
Josephine, thank you.
Okay, so now, coming back to the calendar, we have a motion on the floor. All those in favor of the amended calendar, say aye.
Aye.
Opposed? Okay, you have adopted the calendar with the amended dates, okay? Marilyn, are you doing a PABEA report?
I'm sorry, say again, Beverly.
Are you doing a PABEA report as a PABEA member, or is it a question?
It is a question.
And what is the question?
The question has to do with disaster preparedness.
Okay.
I'm just wondering, excuse me,
Okay,
is this appropriate?
No, not at this time.
Okay,
Sorry.
why don't you just let me know when it's appropriate?
Okay, thank you. Okay, but she doesn't have a report, it's a question.
Oh, we could, because that was when you guys
Yeah, but-
recessed, right? And you guys were talking about
No. This
Okay.
just came out now.
Oh, okay, okay.
Okay. Marilyn, I gotta think. Okay, let's go through the reports and then we'll come to your question, okay?
Okay.
Thank you, thank you. Okay, here we go. Going with Department of Human Services. Is Kathy on the line? I don't have my, I can't.
Oh, I'm so sorry.
Kathy, are you there?
I'm here.
Okay, Kathy.
Kathy.
Hi.
Hi, I just have some announcements. On May 29th, most of you know the State Department of Human Services Director, Ryan Yamade, announced his retirement, and that was effective immediately. Then on May 29th, the governor appointed our Deputy Director, Joseph Campos II, as DHS Director effective May 29th. And just yesterday, the U.S. Department of Health and Human Services informed Hawaii that its Medicaid Fraud Control Unit has been denied federal certification and will no longer fund that unit. There has been several informational news media reporting on this issue, and Director Campos just wants us to know that the Medicaid program provides essential health care coverage to hundreds of thousands of Hawaii residents, and want our members, providers, and community partners to know that their benefits and services will continue without interruptions. And Director Campbell has an open door policy as well as with Meredith. And if there's any questions or concerns regarding any of these issues, you can refer it to him at his office. And I'll put his information in the chat box.
Thank you. Okay, University of Hawaii, Dr. Lewis.
Hello, yeah, good afternoon. I'm home with toddlers today, but yeah, no real update. We are at the semester has ended. We've had 3 of our team members graduate with their doctorates, so we're exciting to have them continue on with us, continuing the Memory Garden project. We're kind of slowing down for the summer, just taking it easy, getting ready to start some new initiatives this fall, a speaker series, establishing an affiliate faculty program to kind of build out our collaborative presence on and off campus, and looking forward to establishing new partnerships as we continue to build out our research We're also in the process of writing a Pepper Center grant, which is focused on functional independence in older adults. And that will be hopefully still an NIH grant that will be asking for applications in about 14 months. So you may hear from us asking for letters of support as we start developing the idea. We'll definitely keep you all engaged in those conversations as well. But yeah, that's our report for this month.
Thank you so much. There's a lot going on. And congratulations to those three for getting their doctorates.
Thank you.
Okay, there's a question, Shelley?
Are you able to give us a 2-minute description of that memory garden project?
Yeah, so Dr. Christina Shida and her team on campus, it's over next to the lab school. There's a memory garden, which is accessible to everyone, so ADA accessible. It was developed with the intention of being a memory garden, so caregivers and people with dementia could come and have engage in activities that were geared towards people with dementia and their caregivers. And given its popularity, it is free and open to the public. You can go at any time. On our website, they have a set schedule of different activities that you can participate in. For example, they've started making create your own tea class where you can learn how to pick the teas that are growing there and dry them, how to harvest different vegetables and plants. And it's all open to the public. It's run by volunteers, and Dr. Melody Halsell it was her part of her PhD research. And so, yeah, I can definitely send more information and we can have that included. But it's a wonderful resource. You can access it at any time. It's not locked off or blocked off. So it's a wonderful place, even if you just want to go sit and just be quiet for a while too.
Okay, thank you.
Thank you for sharing.
Yeah, thank you.
Any other questions? Okay, going on, Paula sent in, that she was going to be out of town. Okay, Department of Transportation. I don't think there's anybody.
Let me look real quick.
I didn't see. Okay, nope, but I see Alan. Okay, Alan.
Hi, Alan.
Hi there. I sent you a few lines, sort of good news within the overall bad news. Excuse me. We got a larger than expected second grant from USDA for the senior farmers market, and that's pumped up the number of participants that we have for this year's program. I'd like to mention something that I did not say in the actual report, and that is that Food Bank has basically decided to donate its administrative, the amount of money that it receives as admin money. 10% of the money that it got from us over for the whole year, something like $19,000, rather than dealing with the paperwork involved, electronic paperwork. They just decided just throw it in $50 chunks, to increase the number of participants that they can serve and just absorb the costs. The paperwork bother is really not worth the effort for them. A great service, and a donation really on their part, and should be thanked and respected generally by the general public. So that's why their numbers are so high. On Oahu, 5,248 is their total number available for this year, and 386 on Kauai. Sometimes Kauai is a problem. They can't always get everybody, but the 5248 on Oahu, it'll easily be subscribed, and there will probably be a waiting list. And what may well happen is that some of those Kauai numbers will be transferred over to Oahu. And the other thing, which is something to cheer, is that for the very first time, the program is going to be extended to Molokai.
Wow.
And to the main farmers market on Molokai. Um, Maui Economic Opportunity has been able to do that. So other than Lanai, all inhabited, major inhabited islands on um, uh, in the county of Maui will be served, at least to some extent. Big Island is always a challenge because remember that the Big Island of Hawaii, you look it up. The Big Island of Hawaii has, in terms of land area, 4/5 of the geographic area of the entire state of Connecticut. It is a real challenge for anybody to deliver services there, whether it's the county government or state government doing county, doing services there, or the Community Action Agency there, HCEOC. But they've got nearly 1,700 slots available to serve Big Island. Bear in mind that usually Big Island, despite having a rather small population compared to Oahu, has often enough 25% of the state's poverty level population. 25% of the poverty level population statewide is on the Big Island. And so it's always a challenge over there. So that's where what our numbers look like in the summary I gave you. And so the program continues, as I say, from April Fool's Day to Halloween. Those are the operating days of the farmers market actual days of operation. But the service providers are hard at work, over the new year, getting the coupon books printed and um, checking up on the farmers from last year to see if they're ready to continue resume work with the working with the program for the next year and so on. So it's a year-round job for the service providers, and we're very, very grateful that we have the food bank and that we have those two community action agencies, Maui Economic Opportunity and Hawaii County Economic Opportunity Council on the Big Island. Any questions?
Questions?
So just to confirm, then it's only for Maui Island and Molokai, Lanai, not yet.
Not yet, no. Lanai is a very, very small population base, so it's always a challenge. Wherever we have small population bases, It's a challenge. I mean, the other program that I handle here at OCS is a state funded employment services program, and we have not been able to contract for Kauai since early in the COVID period. It's just too tough. Kauai has a population base of only 65,000 people. And so it's very, very difficult. And really, really difficult to try to administer services over there.
Okay, any other questions? If not, thank you very much, Alan. Okay,
You're
going,
quite welcome. Happy to help.
thank you. Okay, we don't see Department of Education, but Janelle is there.
Hi, everybody. Good afternoon. I know, folks have kind of started looking into or have talked about the federal funding for the Hawaii's Medicaid Fraud Control Unit. Just letting you know, CMS hasn't released anything as far as official talking points, but if you do have specific feedback that you want to give, you can send that my way or to our general inbox, which I will put in the chat. The other thing that may be pertinent and something to know is that on June 1st, CMS officially issued its interim final rule with commentary period on the Medicaid work requirement rule, which is to start on January 1st, 2027. Essentially, this applies to non-pregnant, able-bodied adults between the ages of 19 and 64. I can send in the chat CMS's official newsroom article summarizing what this means and who it identifies and what exactly the wording is around that. Again, this is an interim final rule, so there is a commentary period. So if there's something you don't agree with or something you just want to make known, you could do that through the Federal Register website, which I will also add in the chat for comments. Likewise, you can also send unofficial comments to me, but the best way to do official comments so that it can get, thought, it can be part of the ruling for this rule is through the Federal Register website. That's it for my updates. Thank you.
Any questions? Shelley?
We send it out to us.
Okay,
Yeah, cause
Janelle, do you want to ask? Janelle, can you, just put that information in the chat and we'll make sure we get it so we can send it out to all the PABEA members. Thank you.
Absolutely. Yep. Can you send it to me too? This is Charlene Iboshi on the
you
big
know
one.
what, we'll send it to
The mail list.
the mail list that we have, Charlene.
Okay,
And
thank you.
you're
That's
on the
an
mail list, so we'll send it to you too, okay?
okay. Thank you.
Thank you. Okay, coming down to our agency report, Kauai.
Hi, everyone. Just very brief minimal report. So we, like Caroline said, we had our Older Americans. It was a very fun and successful event, and we're very excited to start planning for next year. Right now we're really working to just fill our vacancies. It's been an ongoing struggle, so that's kind of what we're doing right now. Workaround is we've lowered our positions to kind of a trainee level so that we can get more applicants, and then from there kind of put them on the career path to reinstate it back to its permanent class. And then also what was already mentioned, working on the area plan. So we are right now in that distribution phase of our surveys, getting input from our kupuna as well as providers on here on Hawaii. So that's it for licensing.
Any questions? Okay, I have a question. How are you getting this for your area plan? How are you getting more information from the outside public?
Sorry, what do you mean by that?
What I mean is if I'm not a participant of your programs and I'm not a provider of your programs, how am I able to give input to the next area plan?
So we distributed our QR code and the survey link to all county council members, and they distributed to their districts. So they're not necessarily in our programs. They distributed to their districts. We had also distributed to Vibrant Hawaii. So Vibrant Hawaii is a nonprofit here on Big Island. I'm sure you know Vibrant Hawaii, but they also help distribute it to the people that they are in contact with. We're working with them to set up focus groups in every district on the island. We distributed the surveys to our research and development team here at Hawaii County so they could distribute it to their contact list. And then we distributed the surveys to different providers that we are working with, along with the programs that we have. So we're not just only distributing to the programs, but we've worked with different departments, different community organizations, and our county council members to get the word out across the island. So anyway.
Okay.
I have a sample. There's a survey.
Okay, thank you, Charlene. Okay, going on.
It works.
Thank you. Thank you. Okay, Derek is not here, so we have to stand by his written report that he submitted. He had an emergency today also, so he is not here.
Bev, could I ask a question about Derek's agency? Perhaps you know the answer. I heard that office gives training or seminars or something on tips for seniors who live alone.
Okay, I would have to refer back to the director. If not, we would have to go back to Derek, because I don't know.
Yeah, I don't want to speak on his behalf. Okay.
So,
Yeah, all right, no,
Okay,
we
I
can,
would-
yeah, no rush, but someone just mentioned that to me and I thought I'd see him today, so I thought you guys might know.
Real quick, what is, if you write it in an email and you send it to Derek directly, okay,
He'll respond.
because he'll respond to you directly about it.
Thank you.
And his email address is on that mail list that we get.
Okay,
Okay?
thank you.
Thank
Bev.
you. Good question though, Barbara. Okay, Emily, Kauai.
Hi, sorry I wasn't able to be there in person. We have a lot going on. Similar to Kauai, we are focusing on making sure our staff is full, I guess, or complete. And so we're almost there. We've recently staffed 2 of our accountants, which has been nice. We've been doing accounting for the last couple months. And so that's been very helpful. We have hired 2, and the idea is to kind of have them at that same level. So cross-training each other right now. We're fortunate to have an intern. She is a graduate of Kapa'a High School and is in her 3rd year in college. So she's been very helpful because she's been helping us enter our results from our survey into SurveyMonkey, and also acting as, or training as, one of our information referral specialists. So I'm having her go out in the field with the staff and also help man the phones and just acting as that first point of contact. So just really jumping in there and getting to learn about our system, because that's where our vacancies are. 2 information referral specialists that we need to fill, and then I think we're good. We had our retirement. Lillian retired, and we reallocated one of our staff to her position, the data analyst. And so she's been busy processing invoices and learning Monami. So that's been kind of a learning curve for everybody. We also just recently relocated out of our office into our conference room across the way. So yeah, that's been an adjustment. We are, something new is we're doing a collaboration with the homeless with the housing department, and we're trying to see how we can help homeless, whether it's, I mean, of course, we're always a resource there, but we're trying to purchase items and, like kits, wellness kits for them, slippers, ponchos, just to help support that. When I've been at council the past couple of times, I've had that question asked, what are we doing for homeless? And as you folks know, we can't, it's like an indirect, but we felt like this way we'd be able to support them in that way, and just looking forward to more collaboration to help with that population. We're doing our surveys. We have focus groups. We started the very first one we did was with our agency, just to kind of get a feel of how that goes and feedback from our staff. And that was kind of like a mock or a trial. And then we've been going out to different agencies, providers, hospitals. I'm also going to touch and hopefully reach out to county council and our department heads and to get their input. So that's kind of what's going on with Kauai. Oh, and then sorry, one more thing. We have our Elder Justice, our second annual Elder Justice Conference. That's going to be in about 2.5 weeks. We have Paul Greenwood coming down again. So we're super excited because, as Caroline mentioned, it is Elder Justice Month. And so we hope to make this an annual tradition. And one last thing, wanted to thank Caroline. Thank you so much for taking your time to fly out to Kauai and being there. And it just worked out where she was able to announce our 2 winners. And so that was really special for us. So thank you.
Thank you. Okay, Rowena?
Okay, so just to summarize my report, one of the new things I have in here is data administration. I put together a chart using our new Monami reporting system. So it'll show you the service type, the amount of clients for each service type, the number of units, and the sum of the costs. So it's a really great feature to have. The only downside is that it doesn't include all of our home delivered meals because there's an issue with the data collection and the way the information gets put into the system. So I'm hoping to improve that by the next PABEA meeting. We're also having issues with our vacancies, and it's not so much trying to fill the positions and getting up the recruitment. It's to funding. So as you may know, we get 3 pots of money: county, state, and federal funding. And right now, in our fiscal year 27 budget, we've shifted about 4 positions from ADRC funding over to general funds so that there's more stability in the funding source. So that opens up frees up some of the ADRC funding. And I'm working with Caroline and Candace to get make sure that we have stable or sustainable funding so that we can fund these positions. We also fund positions through our Title III funds. So if we see that there's no movement, like increases in our Title III funds, but we see increases in direct services, we're going to prioritize making sure direct services go out to the seniors before we fill the vacancies. So that's kind of been an issue that we've been working on for the past 2 years now. And that's why we have vacancies in our Title III funded program. Another highlight in our report is that we're working with Adult Protective Services, Maui Police Department, and with the hospitals to find solutions for temporary sheltering for kupuna who are in situations where they're displaced during an emergency event, whether it's a caregiver who's incarcerated overnight or an abusive situation. Because right now, if a senior is in a situation where they're getting abused and then there's a call made, police department comes, removes the senior from the home. If they have dementia, there's really no place for them to go. So they've been brought to the hospital, but that's not an appropriate place for them, or hospital won't take them. They've tried Women Helping Women, but sometimes there's issues with intake. Some of our homeless shelters are full. So we need to find a solution so that there is some kind of 24-hour temporary solution for them in a place where there is a professional who can assist them with their needs. And then maybe a case manager to identify next of kin or other people who can provide support. So I'm hoping to get more information about that and maybe report on our progress in the next couple months. And also some happy news is that we nominated one of our Aging and Disability Services specialists for a national award. Our ADSS 4, Carrie Valdez, has been selected as the recipient of the 2026 Community Champion Award presented by Moms, Meals, and US Aging. She just found out the other day, so she's going to be recognized at the national conference happening in July. And so she gets a free trip to San Diego hotel and a conference registration. And Carrie's been with the agency for over 30 years now. She's also in her 70s, and she still continues to do case management, intakes over the phone, and home visits.
Oh my
And
gosh.
one of the things that I put in my nomination is that she supports a lot of families who are in discussions about long-term services and support. So oftentimes she's kind of refereeing between siblings and parents and children. And she also had an instrumental role in the Lahaina Kula wildfires and connecting seniors with services. She helped out one family that was still in their condo in Lahaina when everybody else had left and they had nothing left. And so she was able to help them with their ID cards and connecting them with transportation services, among other things. But yeah, Carrie's been a long time employee with the Office on Aging, truly committed to providing services. She's a kupuna herself, but she still continues to do such great work for our community. And we're really excited and happy for her that she's getting this national award.
Thank you, that's very honest. Congratulations to her. Thank you. Okay, Marilyn, your question about disaster?
Yes, a question and also some comments, if I may.
Question first.
The question is, has anybody, and Lonnie may be able to know that, either any government people, private, whatever, been included on these meetings about AI predicting what a disaster will look like in Hawaii? Anybody?
She says no.
I just happened to have a friend who was on that, and I literally was sick at my stomach when I finished.
Marilyn?
Yes.
Marilyn, this is a subject area that we really don't know a lot about. Maybe you can gather some information and we can have it at next month's meeting?
I won't be here. I'll be gone for the next two meetings. So let me just Beverly, just let me briefly say what I need to say, because this is extremely important. When they went through the AI, that gathers information from all over the world, from disasters that have happened to disasters that could happen. And Hawaii is just a disaster waiting to happen. We've got, the weather's going to be bad. We could be attacked. People are not storing food. And the first thing that's going to happen is people are going to be hungry and thirsty. And there's no holes barred when families are looking to feed their children. So they're talking about really horrible things that could happen. And, we can't predict, but if we lose the ability to have things brought in by boat or by air, or if we have a weather problem like the Kona low that wiped out our local food process, it's going to be up to each one of us to have a food supply. They suggest for 2 weeks, but after this AI, it might be better to have a food supply for much longer than that for water and food, because it literally could be that we don't have anything coming in here of any significance. And people are going to be very sick and hurt, particularly elderly people that live alone and don't even know about saving this kind of food. So it just seems like something that we all need to take much more seriously. I can gather more information. It just kind of puts a damper on a nice meeting with good things, but
Marilyn,
it's so important.
It's a good subject matter. It really is, because you're introducing to us another area that, Kapuna will be very vulnerable, especially when they read something that AI is projecting. So we'll look for more information, and then when you come back, maybe you might have some other information and we can have a guest speaker come in or somebody knowledgeable about it, or at least something to give us a brief introduction of all of this. Okay.
I'll be glad to, but we are in hurricane season now. So everybody just be very aware that everything that you eat and drink should be available to you in your house. and there's
Sure.
not shelter, there's not going to be enough food. So it's going to be up to you to take any precautions that you can for yourself or your neighbors or your family. And that needs to be done right away, because when I get back and can talk to you in September, it will have, the time will have gone by. But this is going to be a problem that stays with us for years and years and years.
And
Marilyn, yeah.
Marilyn, Janelle just put in the chat that she'll be happy to see if anyone in the administration for strategic preparedness and response is utilizing AI. So, you know, thank you for bringing it up to us today, because it is a very important area, especially now, like you say, it's hurricane season. And we already know it's supposed to be a bad year for us this year, so everybody should prepare for it.
Yes.
Thank you very much. Okay?
Yes.
I think she had something.
No, that was it. That was her comment.
Okay.
She asked the question, that's why I'm about the AI.
Okay.
Okay, thank you. There will be a Caputa Caucus meeting this afternoon at 2 p.m. Older American Month event is on June 12th at 15 Craigside. Time is 10 a.m. The next monthly meeting will be on July 10th at 12 p.m. On Friday, July 10th at 12 noon. Seeing we have no other business, Ms. Shelley, thank you so very much, and we wish you well, but we hope you come back to us, okay? And
You have return rights.
yeah, you have return rights, Shelley, you have return rights, okay? So, without further ado, thank you very much, and this meeting is adjourned at 1:06 p.m. Thank you.
Thank you.